Mucus and mixed glandular epithelium. So mixed means you've got a mix of mucus and serous secreting cells. Down here, you are looking at cells that will be secreting more of a liquid. And then up here, where it looks a little more airy and that implies fatty, then you're going to be looking at mucus secretions coming out. So this isn't actually a very good graph. These darker staining cells will have a higher water secretion with more enzymes in them. And then the other cells will, and they're called serous cells. And the others that look more airy because of the fat that's accumulating in them will be the mucus cells. So we'll find out that mixed exocrine glands, the submandibular is mostly mixed, like 50-50 of each. Sublingual is primarily the mucus secreting, and then parotid is going to be a very high concentration, almost exclusively the serous secreting. All of these are epithelial invaginations. So here we've got an invagination of the surface of the stomach that is forming a gland. And this is just the beginning of the gland. There's more gland down below. Just where you sectioned it, you don't see the connection. But there's extensive gland down below with very complex cells. But the upper part of the gland, actually, that is called the pit area, is going to be your mucous epithelium that secretes the protection. What's the pH of the stomach? Around 2, can get down to 1 sometimes. So you need to protect your stomach lining from its own secretions. Okay, so epithelial cells invaginate. If they just go down and form a tube, then you call it a simple tubular gland. If it goes down and then it winds around itself like it does in sweat gland, then it's still simple. What does simple mean? Good time to ask that question. Simple means that these epithelial cells that are forming the duct are forming one duct. All these cells that differentiate into secretory cells, all their secretions go through one duct to the surface. So we look at what a compound gland is. You follow that orange down, and there's more ducts. And the secretions go into multiple ducts and into a final duct to the surface. So come back to the simple. We had a simple coiled, most common is a merocrine sweat gland, which means you're secreting watery secretions from that gland. That's your cooling, helps you to cool off. When the gland branches, but all the secretory cells, their secretions are going into just one duct to the surface, you have now a simple gland, because it has one duct, but it's branched down below. So where do you find that? Gastric glands. They'll have this one pit and then multiple branches down below with all this complex secretory cells down below. Mucus glands of the esophagus, mucus glands on the tongue, mucus glands in your duodenum, not duodenum. We'll hit you over the head next semester with that. But you look at it as duo, so say duo, and then denum means 10. And I'll tell you why now, so you can practice it. Old guys didn't have rulers, so they put their hands down. Okay, I got 10 fingers, but this part of the intestine goes 2 fingers more. So I've got 10 plus 2. And you don't say denum duo, you say duodenum in Latin. So it's 12 finger lengths long. fat fingers of a man, and that's duodenum. So pronounce it correctly. Yes, people out there say duodenum, but they're idiots, and you don't want to be perceived as an idiot. Okay, so simple alveolar. What is an alveolus? It is a grape-shaped ball of secreting cells. So round shape. So one ball of secreting cells secreting into one duct. It's a simple alveolar gland, also called acinar. So acinar and alveolus, you can use those terms interchangeably. They still mean a circular ball of cells. Not found in the adult, is found in the embryo. So you're not going to find that in adult. If you have branched alveolar, still one duct, but multiple branches with circular collection of secretory cells, then you have something like a sebaceous gland. So anywhere you have hair on your face, hair on your arms, hair on your head, you're going to have a sebaceous gland associated with those hair shafts. When your hair stands on end or when you brush your hair, you are changing the shape of the hair shaft. It squeezes on the sebaceous gland and sebum comes out. And that lubricates your hair, keeps it from getting brittle, and also gives it kind of a pilau stink smell. And that's why we shampoo our hair all the time. So our body produces all this lovely sebum, and then we go and we wash it off because it doesn't smell so good. And then our hair gets brittle, and then we have to put conditioners on to make it softer. But anyway, some sebum doesn't smell so good, so maybe you want to wash it off. Okay, so sebaceous gland is an example of a branched, simple gland. Not all of your sebaceous glands are associated with hair. You see people with really bad, big acne on their back. There are a lot of sebaceous follicles back there that also get infected, as well as the ones on their face. A compound gland, multiple ducts. You can have secretory cells that are arranged in a tubular fashion, and you call it a compound because it has more than one duct, tubular gland. So compound tubular, where do you find that? In your mouth. Mucus secreted in your mouth. Bulbourethral glands. These are small little things located in the pelvic floor. They secrete a pre-ejaculate that kind of lubricates the penis so that all these delicate sperm that are coming out don't get banged up and killed before they arrive in their destination for purposes of procreation. So it changes the pH because that urine is used for urine. And it lubricates it so these delicate little guys arrive more or less alive. About 45% are DOA, but you need that 55% if you're going to want to reproduce. Okay, so you also find this shape in the testis. These branches are going to be super long. You go into the testes and you cut into a lobule and you very gingerly tease out one of these looks like rope-like structures in there. It comes out as a big loop. So you coiled it up and crammed it in the lobule. Not really, but in essence, that is the case. So these branches are very, very long in the testes. If it's branched and you have multiple ducts and the secretory cells are in a round ball, then it's a compound alveolar or a compound acinar. So a single duct, and here we've got compound, so multiple ducts. You see that in the mammary glands. And then some areas, you have some areas of the gland that are secreting from tubular secretory cells, and other areas that are secreting from alveolar or acinar secreting cells, going into multiple ducts will come up to the surface. You'll see that in salivary glands, respiratory passages will have that, and pancreas. Primarily pancreas, you'll be seeing that. So know how to identify these glands based on their shape and secretory cell type. If it's a round ball, it's acinar. If it's a tubular, it's easy, it's tubular. And then if it's compound, you have to look kind of closely because test's going to be black and white. You're not going to see orange and pink. So you have to look to see, this is going to be a little darker than this. The secretory cells are bigger. If those small little cuboidal cells extend down below, then more than likely this is a compound gland as opposed to a simple gland. And then know where, from this slide, where they could be located. How do you secrete? You can secrete in a merocrine fashion. Merocrine secretions are watery secretions. We talked about the merocrine sweat gland here. That is a coiled tubular gland. It obviously, its name merocrine, its secretions are going out in a merocrine fashion. So Golgi apparatus will form these secretory granules that will go to the apical surface and then exocytose the secretion. So the plasma membrane that fuses will get recycled. Very little structural alteration to this cell as it's secreting. It just forms the vesicle, fuses, releases, and then recycles the membrane. Apocrine secretion is, there are actually two types of apocrine secretory glands. You have an apocrine sweat gland. Oops, hit the wrong button. So apocrine sweat gland. But it doesn't secrete in an apocrine fashion. Unfortunately, older people, because of the stink that came out of these apocrine glands at puberty time, they thought that the cell was losing a lot of its self with the secretion. You look at this definition, the top part of the whole cell is the secretion. Based on the amount of fat that comes out of your apocrine sweat glands, they figured they would name it apocrine because it was losing part of the cell as the secretion. No, this apocrine sweat gland is secreting in a merocrine fashion. Sorry, can't do anything about it. Nobody has changed the name of the gland. Maybe they could hyphenate it or something, apocrine merocrine sweat gland or something, but no, they still call it apocrine. Now you have to realize it's actually secreting in a merocrine fashion. True apocrine gland is your mammary gland. Your milk that you're giving out to the baby is containing the milk products plus a lot of the lipid from the cell. And this is providing more nutrient for the baby. It needs fats, it needs proteins, it needs carbohydrates. The milk has the carbohydrate and the protein, but where is the fat coming from? So the fat is coming from the cell membrane. So the baby has all the nutrients for its growth. So apical part of the cell breaks down. You see it's starting to break down here, starting to break down here. Eventually this whole top part of the cell will slough off. So you got the secretions plus the cell. No organelles are lost, so you have the building blocks to replace what was just lost. So they then make a new apical portion of the cell for the next time you want to secrete. So mammary gland is an example of a true apocrine secreting gland. Down here, the sebaceous gland that we talked about Actually, this illustration is wrong because the sebaceous gland is on the other side of the hair shaft. It's between your erector peeling muscle and your hair shaft. So when this contracts and changes the position of the hair shaft, gets more vertical, then the sebaceous gland gets squished between your muscle, smooth muscle, and the hair shaft, and then it secretes into the hair shaft. So don't take this illustration as being correct, but for the purpose of explaining what the sebaceous gland does to make its secretion, it just totally breaks down the whole cell, nucleus, organelle, everything goes out as the secretion. So you look down below, this is stratified glandular tissue down here. What's going on?
Formation of new cells.
Formation of new cells, mitosis. You have to replace those cells that are the secretion. So the sebaceous gland will have a high mitotic rate, far more so than the others that, okay, if the cell fatigues, if it's damaged, and then you got to replace it. But here, the cells are the secretion, so you have to replace them at a high rate. So cells kind of burst, but then they detach from the cells below, and then the cells below are now the next secretion. So new cells are formed down below from the stem cells, and you get this upward migration. Connective tissues. We're going to have supportive connective tissues that give physical support. So bones and cartilage, those are examples of supportive connective tissue. And then we got connective tissue that connects things to other things in a physical fashion. Depending on the fibers, they have different types of appearances. They all have certain things in common. They have specialized cells to form fibers and maybe also secrete things. One thing that they do secrete is a ground substance. Ground substance kind of looks like maple syrup in its consistency. It kind of fills in space between fibers, a lot of extracellular fibers, some very delicate. Some are designed with big spaces in them so you can hang other cells in those spaces. Sometimes the fibers are close together because you want a tensile strength. You want flexibility, but you don't want stretching, like in the tendons that are and ligaments for your bones and muscles. So matrix is a collective term for everything that is outside. Extra, if you don't already know, means outside. So extracellular, outside the cell. Intracellular, that's a little harder and a little easier to understand. So extracellular is outside. Any connective tissue that's made up of proteins and ground substance will make up your matrix. Matrix could be mineralized, it could be this syrupy, watery consistency as well. So in bone and cartilage, you have less of the syrup and more of a stiff component. So breaking down connective tissue, what they call connective tissue proper, that is your tendons, your ligaments, your areolar connective tissue, which is loose connective tissue where cells can migrate through and blood vessels can be there and you can store a little bit of fat in those. And then you have your dents where the fibers are closely packed together and they're usually avascular, meaning there's no blood vessels in them. So loose connective tissue, you have this areolar tissue, which may have macrophages in it, mast cells in it, might have some adipose cells, it has a lot of blood vessels, it has collagen and elastic fibers. It's designed for stretch, but it's not elastic enough to be considered an elastic connective tissue. This has some elasticity. Adipose is loose because when they looked at it after they fixed it and put it on a slide, that fixation process washed out all the fat. So the cell membrane that was left looked like it was blank space. And so they classified it as loose, but in actuality, it would be full of adipose. So it's in the classification of loose, but cells don't wander through adipose cells, and you don't have blood vessels going through adipose cells. So it's not as loose as areolar tissue. Reticular is a collagen fiber that's very delicate. They come together to form a framework for other cells to hang out on. So in the immune system, where you want your immune cells to be able to anchor themselves and hold on and check for pathogens, or in the liver, where you want cells to be highly organized so that when you pass blood by them, they can selectively take up toxins and detoxify you, or pick up nutrients and make good things for you. You have this reticular network of fibers, so you can hang your hepatocytes on those cells, on those fibers. Dense, you have dense regular. You put a little tension on those collagen fibers, they're all parallel. All the nuclei are lined up parallel. They're very regularly arranged collagen fibers. And also the nuclei of the fibroblasts that are secreting them that are still in the tissue, very densely packed together. Dense, irregular, you've got a lot of fibers, but they're not parallel. You put stretch on them, they still are going in very many different directions. You use dense irregular when you want to make a capsule for an organ that might be increasing in size due to edema, and so it's changing its size. It gives a little, but it still provides a nice protection for that organ that's inside. So dense irregular, you find it around your kidney. You find it in areas where you want to form a capsule around an organ. Elastic connective tissue, you have elastic connective tissue here. You deform your ear and let go, your ear is back to normal. You have elastic connective tissue in your epiglottis, you swallow, and as soon as you go back to talking or breathing, bam, it's right back up. So it bends and then it springs back. So any place where you want this elasticity, that's where you're going to find elastic connective tissue. There's elastic connective tissue and there's also elastic cartilage. So we'll get to that over here. There's elastic cartilage as well. And actually this is elastic cartilage and that's elastic cartilage. But you have elastic connective tissue as well. Connective tissue proper. So cartilage, it's more solid. It also has a rubbery consistency, but cartilage that's between your bones in your thoracic cage, or the cartilage that's on the long bones, that's actually kind of brittle. It's a hyaline cartilage, and it compresses and springs back after the compression is taken away, but it's also brittle enough that if you get a blow, it will fracture. If you're doing CPR correctly, you're going to fracture the cartilage. You might fracture the bones too, but you're going to break cartilage. Elastic cartilage is designed to be deformed and then spring back. Fibrocartilage, like between your discs in your vertebral column, your pubic symphysis, those are designed for resisting compression, but less of a nutrient kind of exchange in the fibrocartilage that you would find in hyaline cartilage. And bone cells have to be smart enough before they start to form bone, otherwise they're going to die once they form the bone. Once they surround themselves by their own matrix, they're not going to get any nutrient from the blood supply in the bone. So they have to form gap junctions between each other and then start to secrete the mineral matrix, so that the guy that's closest to the blood supply can get the nutrient and pass it through the gap junction to the guys that are further away from the blood vessel. Waste products have to go back to that inner guy to get put into the bloodstream. So because the matrix is solid and crystallized, you limit, well, you actually kind of obliterate the ability for diffusion to occur there. Blood is a fluid connective tissue, as is lymph. So these are meant to carry things from one part of the body to the other. So they're classified as a connective tissue because of this traveling throughout the body, but very different from connective tissue proper or supporting connective tissue. Okay, areolar connective tissue. You're going to have fixed cells that they've labeled them and they found they stay put. They don't wander in and out of the tissue. But you've got wandering cells as well. So you've got wandering cells that are macrophages, and then you've got fixed macrophages. Fixed macrophages tend to be the surveillance. They're looking for pathogen that might come into the tissue, and then they stimulate other white blood cells to come in when the pathogen is there. So wandering cells come in to help to fight infection. Sometimes they wander through, no infection, they go on out. The fixed macrophages will stay there. They're going to phagocytose the pathogen, maybe damage cells in the area, and clear out the rubbish. Fibroblasts are going to secrete the proteins. And your mesenchymal cells are going to then differentiate into other types of cells. Mesenchymal, we found out, were the embryonic cells. Melanocytes, you'll find them there. They're going to secrete, well, they're going to form a protein that is then going to go to other cells and then form the color of your hair, color of your eyes, color of your skin. So they synthesize the melanin. Mast cells, lymphocytes, they're going to, mast cells sometimes come in. There'll be debate as to whether you have wandering mast cells or you have fixed mast cells. We'll get into that debate here, but just because your book is saying a mast cell is a wandering cell, don't get upset when somebody else says, well, there are these basophilic cells that are in your tissue all the time, and they call them just basophils. Mast cells also stain blue, so they are basophils. Lymphocytes will come in as part of the immune response. Mast cells are part of the inflammatory response, as well as macrophages that are fixed and wandering. Part of the immune response is to set off an inflammatory response. You know that when you get inflammatory response in the back of your throat gets swollen and it's hard to swallow. And you can tell that there's restriction back there. Sometimes it's even hard to breathe. Macrophages have the same kind of capability as a macrophage does, but a macrophage can engulf bigger particles than a microphage can. Macrophages are smaller in the first place, so they're limited in what they can actually ingest. So they're phagocytic. Neutrophils and eosinophils are smaller in size. They're still pretty good size, but they're smaller in size than a macrophage, and they also phagocytose. They usually come in response to the secretions from free and fixed macrophages that are responding initially to infection. Collagen fibers. I sat down and tried to figure out how many types of collagen are there. I got up to 24 and then stopped. There's way too many for me to be concerned about. I know now that there are at least 25 different types of ways you can put collagen fibers together. And then people who study collagen will classify them in their nomenclature. I just know that collagen is ubiquitous in your connective tissues, except for your fluid connective tissues. You got a lot of it. It's going to make up your dense irregular, your dense regular. It's going to have elastic components that are called elastin. They're still made by the fibroblasts that form the regular collagen. You look collagen fibers and how they're oriented together. You still take a collagen fiber and you put it into a very thin network, and you got a reticular fiber. So the fibroblasts are forming all these fibers depending on how you put things together. You get something that's very elastic, and then you call it elastin protein. You have a reticular fiber, you call it a reticular protein or a unit of collagen protein. And then you have the collagen that you can have all these different things, different designs. So here, very commonly, you have 3 subunits that are coiled around each other. You look in bone. If you want to do something freaky and you're a carnivore, get a chicken bone and put it, it doesn't have to be a raw chicken bone, it can be a cooked chicken bone. Put it into vinegar overnight and then come back. It still looks like a chicken bone, but when you put it in, it doesn't bend. When overnight you come back, you can tie it in a knot. So the acetic acid will take away the mineral matrix and leave the collagen behind. The collagen in your bone is important because you don't want them fracturing. If it was solid mineral matrix and you hit it with a blow, it would fracture. But you have this collagen that gives it some resistance to that blow. Yes, it might break, but it's less likely to break with the collagen than without the collagen. First thing that happens when you make a bone is you got to lay down the collagen. Then you got to get the cells that will mineralize it and form the bone. So collagen is the strongest. Elastin is designed to bend. And later on in your life, you're going to find that your elastin fibers aren't made so good anymore, and so things start to sag a little bit more. And people are always trying to sell you things, oh, this is going to get your elastic fibers back to their original shape. Well, I don't know, maybe they will. But you got to spend a lot of money to find out if it will or not. Okay, so areolar connective tissue. You look at it, it's got open spaces. It's got elastic fibers, bigger fibers that are collagen. This blank space was full of fat, but when you fix the tissue, the fat was washed out in the alcohol. And so it looks like a blank space. But if you look around, there's a plasma membrane. You look over here, there's a nucleus. It's pushed off to the side. And the nucleus in adipose cells usually are pushed off to the side because the rest of the cell is full of the triglycerides. And so the nucleus and all the other organelles are pushed off to the side. You have a mast cell that's there. It picks up blue dye, so you could call it a basophil. You have macrophages that are wandering in or fixed into the cells. Into the tissue. So you have this loose connective tissue in the dermis. So it's going to help to control or attach the epithelia to the underlying structure. You're going to have the upper part of the dermis kind of a looser, called a papillary layer to the dermis. And then you'll get down into a reticular layer, which is more of the heavy fibers. And then you get down below that, which is your hypodermis, and you're going to find a lot of fat there. So a looser connective tissue down there. Epithelium of intestine, respiratory tract, urinary tract, between muscles, especially where you want the access of blood vessels and nerves to the muscle for function and nutrient delivery. Around blood vessels, nerves, and joints, you're going to find this areolar connective tissue forming joint capsules and anchoring those structures to other structures next door, but still allowing for other things to get in that space. So it cushions, but it also permits a lot of movement, provides space for other cells to wander in and out. Another loose connective tissue is your adipose. Truly, it's full of triglycerides, but in the fixation process, you haven't already done it. You have to run your tissues through a series of alcohol dilutions to get them to pick up the stain. In that process, lipids are washed away, so it appears very open and lacy. And so it is classified as a loose connective tissue. Because the nucleus is off to one side, it looks like your class ring from high school. You have some kind of a cabochon, some kind of jewel there, and then you've got the band that kind of tapers around. Take it off and you look at it, it's got this peripheral piece of jewelry here, and then this band of gold. So they call it signet cell, which stands for your signet ring. The nucleus is displaced off to one side. This is for cushioning and padding and keeping organs in their correct space. So a lot of your organs will be surrounded by fat. Your heart has fat on it, some for protection and some for positioning. Kidneys have fat around them. If you lose the fat around your kidneys fall out of place, your blood vessels or your ureter get constricted, you go into kidney failure. So people who are anoretic and lose their intra-abdominal fat run the risk of kidney failure. That's what kills them. Wasn't the diet necessarily, but it resulted in death. Insulation, yeah, we all got subcutaneous fat for insulation. It does store energy, and now we're finding out it also secretes hormones that can mess you up or help you. Reticular tissue, very tiny little interwoven fibers, very delicate, but other cells are adhering to those fibers. It could be immune cells in the spleen. It could be hepatocytes that are now put in place in the liver to give the orientation for blood to flow by, so hepatocytes can pick up the things that they need to remove from the blood. So liver will have reticular tissue, lymph nodes, also immune cells hanging out there, wandering through the lymph node and looking for pathogen that may be coming in the lymphatic fluid. Mentioned spleen, again, white blood cells looking for old raggedy red blood cells hang out on reticular fibers in the spleen. And then the cells that form your blood and your bone marrow, they will hang out on reticular fibers. And they will then differentiate and become mature enough to be released into the bloodstream. So they're primarily a supportive network for other cells. Now this is dense regular. I said that all the fibers are supposed to be parallel. Well, this is relaxed, dense irregular. If you put a little tension on it, it will straighten out. The fibers they'll stop looking squiggly and they will become parallel. And the fibroblasts will all line up parallel with parallel nuclei. So these provide attachment. You'll see them as ligaments. You'll see them as tendons that attach muscle to bone. No blood vessels. This is avascular. So you rip a tendon, you damage a ligament. It heals very, very slowly. Better to rip the muscle, it's going to heal faster. Better to break a bone than to rip a tendon or a ligament. The deep fascia, somebody asked me, isn't fascia a connective tissue? Yes, fascia is a connective tissue. It's not a supportive connective tissue in the sense that bone and cartilage are that provide physical support. But the deep fascia does support organs, and it does help to keep muscles and things in their proper position. There's a lot of different types of fascia. The fascia is usually growing out with the muscle. And so and also with the skin, so after you get down below your dermis, you're going to have a superficial fascia, which is your subcutaneous fascia. So you have different terms, but it's telling you it's the most outer fascia. And then you have fascia that goes around muscle, and then you're going to have fascia that's, if you come all the way in your rib cage, you're going to have fascia that is the deepest, but they refer to it as subserosal. What is a serous membrane? Go back to that simple squamous layer of cells. That's your serous membrane. This is deep fascia that's underneath that. So fascia is all over the place. It separates, it keeps infections that are in one area from getting to deeper structure, or if it's already deep, it prevents things from getting out to more superficial areas, provides attachment, reduces friction. Well, not by itself. A tendon has a sheath around it, and you have synovial fluid in that sheath, and that's what decreases the frictional force. But the tendon is designed to be smooth enough that it's not going to create a lot of frictional forces itself. Transmits force, you contract your muscle, the tendon transfers it to the bone, and your joint will change shape. Ligaments stabilize bones, tendons and muscles also stabilize bones. You have a tension always in your skeletal muscle, except when you're in REM sleep. You pick up a kid in REM sleep, he's like a rag doll. She's like a rag doll. But if you go to anybody who's not in REM sleep and you try and pick up their hand, there's a resistance. You touch their muscle, there's tone there. So stabilizing bones, that's what this muscle tone is all about, is keeping the joints in the right position. If your muscles were totally relaxed, then gravitational forces acting on your joints would cause them to stretch out of shape, and you have a lot more joint problems. Elastic connective tissue, an elastic ligament. You find this in between vertebrae. So where your neck, where are you going yes all the time because you're a very compliant person. Also when you say no, it's also stretching your elastic connective tissue. But mostly when you say yes, you're nodding your head. The ligament that's going up the back of your spinous process, that is called the ligamentum nuchae. And then you also have one inside your vertebral canal that's called the ligamentum flavum. And these are elastic ligaments designed for that bounciness. So you're in class, you're falling asleep, boing, your head comes up and you wake up. So that elasticity causes that boing to wake you, well, that boing causes you to wake up. Supporting the penis and allowing it to come to erection and go to flaccid and all this. Elastic components in your arteries. You have big arteries like your aorta. You put 70 mLs into this vessel all at once. It better stretch, or you're going to have problems. So stretches, but then it recoils. And so the recoil helps to push that volume on out the rest of the arteries. Transitional epithelium. It has to stretch. If you're going to have 2 liters of urine in your bladder, you better have some elastic connective tissue in the basal lamina there. Dense irregular. Come back to look at dense regular. You put a little tension, you can see the fibers will line up. Even in the relaxed state, they're fairly well aligned with each other. You come back to dense irregular. You got some that are in cross section, some that are in oblique section, some are in longitudinal section. Obviously, they must be going in multiple directions. So that orientation allows for a little bit of stretch, but not a lot of stretch. So capsules on organs, also periostea, around your bones. You need a connective tissue to help anchor tendons to your bones, blood vessels to your bones. The blood vessels have to enter your bones and exit your bones. So you want some kind of supportive tissue. If you have an infection in your muscle, you don't want it having direct access to your bones. So periostea helps to keep the infections out. And sheaths on nerves will be this dense irregular connective tissue, that deeper part of the dermis, dense irregular connective tissue, providing strength and a little stretch, but not much stretch. So overexpansion of the bladder, after 2 liters, you probably can't expand it anymore. You gotta head to the bathroom. But if you're overriding the nervous system telling you to empty your bladder, then you reach the limits of your dense irregular connective tissue and you can't fill it anymore. If you're not able to fill your bladder anymore, you're backing up into your kidneys and you can damage your kidneys. So don't hold your urine too long. Okay, 6 more minutes. Blood, fluid connective tissue. We're going to learn about that next semester. So for now, no, it's fluid connective tissue. It's got a lot of water in it. It's red because of the red blood cells with the hemoglobin. And there's millions of these. There's about 7,000 combined of white blood cells. So if you take blood and put it in a capillary tube and spin it down, you can have a lot of plasma, you can have a lot of red blood cells, and then you can have a little line of white cells. If you're lucky, they don't get stuck in the red blood cells. You'll have a little bit of these white blood cells. Platelets are there, but they're so small you're not going to see them with the naked eye. These are for blood clotting. These are your immune system cells. That's a phagocyte. This is a phagocyte. This can be phagocytic, but it has a lot of granules in it. So the specific granules we'll learn about next semester. Basophil picks up blue dye, and it has specific granules that pick up those dyes. The eosinophil has specific granules that pick up red dye or eosin dye. And neutrophil is called neutrophil because before they had good microscopes, they thought it didn't pick up dye. The granules didn't pick up dye. They actually do. They pick up kind of a pinkish purple dye. They're really not neutral, but they are still called neutrophils. What fluids leak out of the blood vessels, you have to return to the circulatory system. You're going to have tissue edema if you don't get rid of, get that fluid back into the circulatory system, and your blood pressure is going to drop if the fluid stays in your tissue. So 2 reasons, primarily to keep your blood pressure up so you don't have to keep taking fluids in. But if fluid builds up in your tissue, then the tissues can be damaged. So you've got lymph that is plasma minus proteins that has leaked out into the interstitial fluid, and you're going to use the lymphatic vessels to get it back to the heart. The bones and cartilage, fewer cells, a lot more fibers, and then various kinds of ground substance that will be put around those fibers. So cartilage, you have here cartilage cells all lined up in a row. You've got perichondrium. We talked about periosteum, that's around the bone, but you have perichondrium as well. So tissues that are perichondrium will allow for blood vessels to be next to the cartilage, but no cartilage ever has blood vessels in it. So any nutrient that goes to cartilage has to go in by diffusion. The fibroblasts produce the perichondrium, and then your chondroblasts will form your cartilage. So this is called a chondrocyte already, but it is called a chondrocyte after it has secreted matrix around itself. It was a chondroblast, and then it secretes its own matrix, and then it becomes a chondrocyte. As it secretes the matrix, it pushes its neighbor away, and then you start to see the matrix in between all these dark staining nuclei. All cartilage has a similar fashion of forming. This is hyaline cartilage. You'll see that at the ends of your long bones, the end of your sternum, your ribs connecting to the sternum. So your xiphoid process before it ossifies is hyaline cartilage. The floating ribs have hyaline cartilage on their ends, but don't connect to other ribs or the sternum. All your freely movable joints have the hyaline cartilage on their surface. Your larynx is supported open, and your vocal ligaments are supported by hyaline cartilage. You hit somebody in the throat, it will crack, it will fracture, just like when you do CPR. The trachea, bronchi, nasal septum, you break your nose. Most of the time you're breaking the cartilage. If you break up here, you're breaking bone, but out here it's cartilage. Reduces friction when it has synovial fluid around it. It's very good. It's like ground glass, so it's very slick and decreases frictional forces. And then provides a cushioning. To keep your cartilage in your extremities, especially your weight-bearing cartilages, healthy, you need to weight bear. Because you compress and crud comes out, and then you lie down or you sit down and you take the compression forces off, then like a sponge, all the good stuff goes back in. So you need weight-bearing forces to keep hyaline cartilage healthy. Okay, so we'll pick up with the next kind of cartilage.